In a major boost to healthcare delivery in Rubanda district, the Bank of Uganda has donated a solar-powered blood refrigerator worth 35 million Ugandan shillings to Hamurwa Health Center 4. This vital equipment is expected to significantly improve access to safe blood supplies and enhance maternal health services in the region. The life-saving donation was officially launched today by the State Minister of Finance in charge of general duties, Honorable Henry Musasizi. Dr. Abdon Birungi, the Rubanda District Health Officer, expressed his gratitude for the donation, noting that women were regularly referred to Kabale Regional Referral Hospital, with some requiring blood transfusions due to excessive bleeding during childbirth. He emphasized the dire need for such equipment in the district and thanked Minister Musasizi for lobbying on their behalf.
Where we are now is one of our health center fours. We have two health center fours. This is Hamurwa and Muko. And today we are commissioning a solar blood fridge from Bank of Uganda, donated by Bank of Uganda. And this is one of the equipment that we have been lacking at this health facility. We know that blood is an emergency drug. It is needed rarely, but once it is needed, it saves life. And we have been referring mothers from Hamurwa here because our theater is operational. We have been referring mothers to Kabale Regional Referral Hospital for them to receive blood, especially those who bleed too much. And we know that bleeding is one of the leading causes of death among women who are pregnant or who are giving birth. So, because of that, we have been referring those mothers. On average, we have referrals of 15 to 20 mothers per month. And out of those, you find that 5 of them are due to lack of blood at the facility. But now that we have the blood solar fridge, which means that we shall not be affected by interruptions of power. The power here in Rwanda is very unstable, so the power will be stable because it is solar, and therefore we shall always have our blood safe for transfusion, ready for transfusion in case anyone needs that blood.
Dr. Stewart Turanzomwe, the in-charge at Hamurwa Health Center 4, highlighted the ongoing challenges affecting the facility, including poor accommodation for staff and an inadequate outpatient ward. He noted that these issues have hampered effective service delivery.
Oxygen tujine obuginji wija wetenge shagama naye tariho no basa kufa ngene tubiye tutine shagama minister shagama wazi tuyisahihi nitwenda kusima munonga kandi kushaba kugira ngo nabyone bitwete kugira ngo irware nibe model facility ogumoto supporting ogumoto kwata mkono kugira ngo twabaje. I will end with a few challenges. Echombe ko chitu cha general outpatient ababwire bona bakwicira nitekateka mu kikuzire waza ahansi foro yona ishishikire. We think with your support we can renovate that building. Ba staff sabu nyine abinji tibina accommodation hano nitubateganisa especially umuntu yaba yine gukora night duty ninga nano gukora kasheshe okuruga hari kwija hano. Sometimes ushanga cyateganisa itwe ka management niteganisa kugira ngo noshanga bumwe muntu yisha cererigweho wamubuza atenjura yabanza yagwa emotoka zancereza. So ntekateka ngo in future twafuna staff accommodation tukashanga ba staffs bona ni batura hihi nikiza kwija kutuyamba.
Ms. Susan Kanyemiwa, the Secretary of the Bank of Uganda, said the donation is part of the bank's Corporate Social Responsibility CSR program, which was launched in 2016. She reaffirmed the central bank's commitment to supporting initiatives that improve the welfare of Ugandans and strengthen national pride.
Kandi muri abatara bumwe bakuzara ba bleeding munonga, so they need blood. So mwatira tuyambe mututungire fridge konka because of the power surges here mwaja tumwana mbasa kutungira fridge ya powered by solar kugira ngo ebikeki ejo shagama abantu bareke kubatwara kuri abarwire hari muri Kabale. so twahura omuranga gwanyu gavana yahura omuranga gwanyu yabagorra egyo fridge ngwe nicyo kyatureeta aha kukomishoninga fridge egyo na nyamwojo wanyu ogumpa owabateriire yakabega kunogira ngu tarijura akateeka yakabega shinta abokwegi nanka I think this area has had 2 health centers ngwe nimwe mwine omugisha so na nekindi mwene kiri important baba kigambire Dr. Incharge yagamba bushimwe cyane kitwarisire hano onkani.
While addressing the community, Minister Musasizi expressed his appreciation to the Bank of Uganda for supporting and improving healthcare in Rubanda district. In response to the concerns raised by Dr. Turanzomwe, he pledged to work with the district chairman to ensure funds for upgrading the outpatient ward are included in the next financial year's budget. He also committed to forwarding the issue of staff accommodation to the National Enterprise Corporation for further action.
Ejo twaza kuta mu budget y'omwaka gurija ate ejo nanye mu budget yanje mu ministry aho nanye na mugambire Kasiyaba mu binde byarantereza ngo tukore mu Rubanda omwaka gobye sente gurija tutembe sente zo kushuba kuboneza icyo cyombe ko kiboneka. Ekindi kinahurira staff houses, this is going to be a manifesto issue. Ahubwo kuba tukaba twaziraganizeho nka government enyuma twageraho twazikora kushabona titukazimaze mwene uko tubayike mu neki twatandika kutesa hari manifesto ndaza kureba ngo twakigambaho turebe ngo mutameriya nga NRM government twayongera mesente kureba ngo abashaho bitu babasa kurara amagwarira go barakolera. Atiya ndahendera nyemwe bazo nasibire muri mpungu.
The solar-powered blood refrigerator is expected to transform emergency healthcare in the district, especially for mothers in need of urgent blood transfusions, marking a significant step forward in the fight against maternal mortality in the region. Compiled by Nathan Bahangwa for Kigezi Television.